Diabetes is a group of diseases that affect how our body uses blood sugar. Chronic conditions include type 1, that is usually more severe, and type 2. Potentially reversible diabetes conditions include prediabetes and gestational diabetes. Prediabetes occurs when your blood sugar levels are higher than normal, but not high enough to be classified as diabetes. Prediabetes is often the precursor of diabetes if we don't take action to prevent it. Gestational diabetes occurs during pregnancy, but may resolve after the baby is delivered. Some signs and symptoms of diabetes type 1 and type 2 are: number 1, increased thirst, frequent urination, extreme hunger, unexplained weight loss, presence of ketones in urine. Ketones are the result of the breakdown of muscle and fat that happen when there is not enough insulin available. Another symptoms include fatigue, irritability, slow healing sores, um, frequent infections such as gum or skin infections, vaginal infection as well. Risk factors for diabetes include ethnicity, family history, genetic predisposition. Type 2 diabetes is more common in Japanese, Hispanic people, Native American, African American. Genetics, predisposition, and the presence of the disease in many generations plays an important risk factor, especially for type 2 diabetes. Obesity. We all know that obesity is the strongest risk factor for type 2 of diabetes mellitus and is associated with metabolic abnormalities. If your body mass index (BMI) is greater than 30, then it's time to take action to prevent diabetes. Low physical activity and a sedentary lifestyle is another big risk factor that we can prevent. Several studies have shown that lack of physical activity increases the risk in almost 54%. There are three primary benefits of physical activity on the delay of type 2 of diabetes mellitus. Number 1, the contraction of muscle cells induces glucose into our cells, enhancing the glucose uptake from plasma. Additionally, physical activity reduces the intra-abdominal fat, the body fat in general, but especially the intra-abdominal fat, which is known a risk factor for diabetes. Also, moderate intensity exercise has been shown to improve glucose uptake by 40%. Other risk is an unhealthy diet. Red meat is linked to diabetes type 2. Processed meat like bacon, hot dog, and deli meats are particularly bad because of the presence of high levels of sodium and nitrates. Additionally, fast food, beverage, hamburger, ice cream, any fast food is associated with high levels of glucose and fats in blood. Pathophysiology. The pathophysiology of the disease, a malfunctioning of the feedback loops between insulin action and insulin secretion result in abnormally high glucose level in blood. In the case of beta cell dysfunction, insulin secretion is reduced, limiting the body capacity to maintain a physiological glucose level. On the other hand, insulin resistance contributes to increased glucose production in the liver and a decreased glucose uptake in the muscle, liver, and adipose tissue. Even if both processes take place early in the pathogenesis and contribute to the development of the disease, beta cell dysfunction is usually more severe than insulin resistance. However, when both beta cell dysfunction and insulin resistance are present, hyperglycemia is amplified, leading to the progression of type 2 of diabetes mellitus.
Hey guys, I wanted to start by talking a little bit more about the pathophysiology about diabetes. We have to start by understanding kind of what blood sugar is in the whole scheme of things. So when we eat something, our digestive system breaks down the food and it stores the glucose in our blood. So when we eat something, well, depending on what we eat, our blood sugar will go up. And the only way to make our blood sugar go down is if the glucose moves from our blood into our cells. And to make this happen, insulin, which is created by the B cells, it binds to a receptor on the cells, on another cell that the glucose wants to enter. And once the insulin binds, then a hole will open up and the glucose will go into the cell. So if we don't produce enough insulin, what happens is the glucose cannot go into the cell and your blood sugar will just stay high. It has no way to go down because it just continually cycles in the blood. On the other hand, if your blood sugar is too low and you need more glucose in your blood, glucagon is responsible for glucagon triggers the liver to release glucose and put it into the bloodstream. So then in turn, your blood glucose or your blood sugar increases. So the difference between type 1 and type 2 diabetes and how they're contracted is for type 1 diabetes, your body doesn't make enough insulin. And like we said earlier, this normally happens when you're a kid and is less likely in adults, but it happens because your immune cells attack the beta cells that produce insulin. So your body, with less beta cells, it produces less insulin, and it tends to not be enough insulin to keep your blood sugar at a reasonable level. So for type 2 diabetes, this usually happens later in life due to different dietary practices, and your body becomes insulin resistant, which means that not that much insulin is produced anymore, and it's often harder for the glucose to get into the cells because the receptors aren't as they don't have as much of an affinity for the insulin as they did before. So continue, the risk factors specifically for type 1 diabetes can be, we talked about these a little bit more before, but family history, genetics, geography, and age. Something cool that I found is, well, cool to me, geography-wise, as you move farther away from the equator, your risk for type 1 diabetes increases. And diagnosis of diabetes can be through an A1C test, random blood test, or a fasting blood sugar test. And treatments, some of these can be for type 1 and type 2 diabetes. You take insulin to control your blood sugar levels. You count your macronutrients to make sure you're getting the correct amount of glucose into your cells, not too much, and being able to control it based off what you eat. You need to constantly monitor your blood glucose, because if your blood glucose is really high, you don't want to drink something like juice that has a lot of glucose and will make your blood sugar skyrocket. You need to maintain a healthy weight. And something else that I saw was an artificial pancreas is being used in some cases now, specifically for type 1 diabetes. I believe they're looking into doing it for type 2 diabetes as well, but it's implanted inside the person with diabetes, and it constantly measures your blood glucose levels. I think it said every 5 minutes or so it takes a test, and then it dispenses insulin based off what it was. And currently there's no cure for diabetes. So now it's just managing your symptoms. And here are our resources.